One audience member would like to know more about how CLL affects the immune system, including wound healing. And how does CLL impact this?
So patients with CLL usually have a weaker immune system. The lymphocyte, which is the white cell which is affected in CLL, is an important part of our immune system. And due to the presence of disease, these lymphocytes, although there are lots of them when patients with CLL, they tend to be non-functional. So functionally incompetent, that's what they're called. And it leaves the patients immune deficient and susceptible to a variety of infections. Also, lymphocyte is one component. The B lymphocyte is one component of the immune system. There are other components like T lymphocytes, antibodies, NK cells. There's crosstalk between the B cells and this what we call the microenvironment, which is made of the T cells. This crosstalk is deficient in patients with CLL, again, making them immune deficient and susceptible to infection. So that's one defect in their immune system. Sometimes there's something else happens with their immune system where the immune system can go crazy or wacky and start attacking the patient's own blood cells, leading to, for example, decrease in hemoglobin or platelets. We call these autoimmune complications. And also due to weak immune system, patients with CLL can have delayed wound healing, which also predisposes them to infection. So being aware of these complications is important, and using appropriate precautions can be very helpful. Again, because they have this weakened immune system, vaccines are very important. Using all measures to avoid infections, hand washing, staying away from patients, from people who are obviously sick is very important. Sometimes patients where we see they're getting recurrent infections, we can use what's called IVIG, intravenous immune globulins. These are preformed antibodies which are injected into or infused into the patients at regular intervals every 4 to 6 weeks, which reduce the chances of these infections.